Thank you for joining me. My name is Sarah Flusky, and I'm the Chief Marketing and Communications Officer at Nova Healthcare Administrators. For more than 20 years, my job roles have required that I craft communications with the goal of ensuring clarity and understanding. When you talk about employee benefits and communicating those benefits to employees, the task is the same. The challenge is helping to meet employees where they are. On my side of the benefits industry, brokers, advisors, and the employees at your plan administrator are well versed on the ins and outs of employee benefits and plan administration. But the human resources team understands their employees best. They know their audience demographics, how and where their employees work, and what communication platforms they have access to reach their employees. A collaboration between HR and industry experts can set employees up to learn about their benefits and how to use them, leveraging the platforms that reach them best, from in-person meetings to online resources. Truly understanding employee benefits requires learning health insurance industry jargon. Understanding health benefit plan terms can be confusing. When you look at health insurance and employee benefits, you're dealing with a team of professionals who may be involved in selecting a benefits vendor and communicating about those benefits. This could include HR, finance, a broker or advisor, and the organization administering the plan benefits. Each of these roles brings a deep understanding of the products, rules, regulations, and terminology specific to their field. But when it comes to employee benefits, we're all approaching the same discussion from different angles, different areas of expertise, and perhaps a different perspective on the goals of the plan. There are so many letters in the health insurance world. Consumers are often left feeling frustrated, confused, and lost when it comes to decoding the letters, calls, emails, and bills they receive related to their employee benefits. Let's dissect some of this chaos and provide a high-level overview of some of the more uncommon acronyms and key insurance industry terms you should know. When you're in the market for employee benefits, there are a number of industry acronyms you may hear without ever getting the explanation you need to fully understand what you're discussing. This brings to mind utilization management, or UM. This is the clinical team that reviews prior authorization requests to evaluate whether a service or medication is covered by the health plan or determined to be medically necessary, which is different from CM or case management. Case managers are clinicians, usually nurses, who perform proactive outreach to members to help them navigate complex, new, or costly conditions to support the member on their healthcare journey. CM can also serve as an inbound resource for members looking for guidance from a clinician who can help the member balance the care they need with the benefits they have. And while TPA and ASO are often used interchangeably, they are not the same. A TPA, or third-party administrator, generally an independent organization that provides transparent reporting, vendor integration, and flexibility in plan design and benefit customization, where an ASO is an administrative services organization, and it's generally a term used to describe the services large insurance organizations provide to support self-funded benefit plans. These are industry terms that members aren't familiar with because they're business terms and not the terminology a member needs to navigate their benefits. But when you think about the level of understanding required on the administrative side, because your job role requires a certain level of expertise, it's easy to forget that the average member isn't thinking about their insurance benefits the same way we are. So why does this matter? According to one survey, 90% of respondents reported feeling at least somewhat confident in their ability to navigate the healthcare system. And that's great. But 56% feel completely lost in trying to understand health insurance specifically. And of that 56% who report feeling lost, 75% of those are enrolled in employer-sponsored health insurance. When asked to identify the definition of the term premium or health insurance premium, 61% incorrectly chose the definition as the amount paid to cover healthcare services before the insurance plan starts to pay. That's the definition of a deductible. And speaking of deductibles, 52% of those surveyed are most confused by determining what counts towards their deductible. And 47% were confused by what procedures were covered and the same number couldn't discern what constitutes in or out of network care. You can check out the show notes on this page for a link to the survey. However, for everyone else, when these terms aren't needed daily, there's often little time to dedicate to understanding the complexities of the health insurance and benefits industry. Providing employees with easy-to-access glossary of terms can equip them with the information they need to better understand their benefits, including things like coordination of benefits, often referred to as COB, which is a term that members might recognize if they've been asked to confirm whether they have additional coverage through Medicare, a court order, no-fault insurance for accident-related injuries, workers' compensation, or VA benefits. Deductible is a must-know term as it refers to the amount that members must pay out of pocket before the copays apply. And flexible spending accounts, or FSAs, are a broad term that refer to medical FSAs, dependent care FSAs, or FSAs available to offset parking and transportation expenses. And an explanation of benefits, or EOB, whether they receive it through the mail or email or a portal inbox, is a must-read document. If a member overlooks the EOB, they miss the opportunity to get a heads up on incoming bills that they might get from their provider. So with so many industry acronyms and terms, it's easy to see why the average consumer might feel unclear about their benefits. That's why member education is crucial. Smarter consumers are better equipped to manage their health and benefits more efficiently and effectively. Thank you for joining me to learn more about navigating the terms used in benefit plans and why a focus on member education benefits employees. Follow us on LinkedIn or X and check out more of our videos on YouTube. And if member education is a priority for you, check out our podcast, Under the Coverage. It's available wherever you get your podcasts. In each episode, we cover industry terms, topics, and challenges to help members become smarter consumers of healthcare services. And they're really short, 15 minutes or less. So visit us online anytime at novahealthcare.com to learn more.